We've got a new report out highlighting how ready states might be for handling health emergencies, also talking about what improvements need to be made. Joining us this morning to talk about it, John Auerbach, the president and CEO of Trust for America's Health. Good morning, John.
Good morning.
First, talk a little bit broadly about the report. What did it study? What were some of the key findings?
Oh, we've been doing this report for 15 years. Every year we take a deep dive and examination of each state and how well it is prepared for the range of public health emergencies. And this year we found some good news that states are increasingly prepared and more states are making it into the high tier of the highest level of preparedness. And
that can be anything from flu to other illnesses, just infectious diseases, any other just crisis that all hands on deck approach would be required to handle? That's right. The breadth of emergencies has really increased in the last several years. They range from infectious diseases, like now we're concerned about coronavirus. Previously we had Zika and Ebola. It also is weather-related emergencies, so storms and floods and wildfires. And then there are these other unusual kinds of emergencies that arise, like the emergency related to the ingredients within vaping that was causing the pulmonary problems. How is the state of Texas doing in being ready for some of these situations? Texas has an excellent public health department that has been involved repeatedly in responses to a wide range of different emergencies, many of them either weather-related or infectious disease-related. So it's well prepared. It falls into our medium tier of preparedness, which means that as good as it is, there still is room for some improvement. Yeah, a report like this can be so important, like you said, celebrating maybe what is good, but also talking about how any situation can be made better. And I do want to get back real quickly to coronavirus, where the nation is kind of on alert and got its guard up, and yet we haven't seen certainly any sort of outbreak or situation here in this country. But where do you see that situation going from here, difficult as that is to predict? Sure. Well, we of course don't want to get ahead of ourselves. We want to closely monitor what's happening around the world, closely monitor what's happening in the United States. So far, we have 11 cases that have been confirmed in 5 different states, and the CDC is investigating some others that are suspect, but it's been a limited number in the United States so far. However, the best way to prepare is to anticipate what would happen if it became a larger problem in the United States. And so thinking about how our public health departments are positioning themselves, how the other sectors within our states are getting ready for that possibility, this is the time to be doing it. Yeah, and the people who lead those departments from state to state, they can spend their time thinking about worst case scenarios while the general public doesn't need to be alarmed to that degree with that, knowing that they're on the job. Where can people get more information about your reporting and the work you do and kind of find out more? Yes. Well, we have a website that has lots of information. It has the year-to-year reports, and it has the specific breakdown by state, so you can read a lot more about Texas if you like. And it's at our website, which is www.tfah.org. That's for Trust for America's Health. tfah.org. Wonderful. John Auerbach from Trust for America's Health. John, we appreciate your time. Thank you very much. Thank you.